Hello everyone. I will briefly introduce the health situation in the Filipinos for four areas: country overview, recent health indicators, top causes of death, and the overall burden of disease. First, a short country overview. The Filipinos is an island nation in Southeast Asia with more than 7,600 islands and a population around 150 million. Capital city is Manila, and it's considered a middle income country. A key issue is the strong inequality between urban and rural areas. Cities have more accessibility to healthcare and public service compared to remote province. The city is also high exposed to nature disasters such as typhoons and floods, which frequently disrupt healthcare delivery and increase disease risk. According to WHO data, life expectancy is about 69 years. The neonatal mortality rate is around 15 per thousand live births, and the under 5 mortality rate is about 28 per thousand. Health expenditure is around 5.87% of GDP, which limits the health system's capacity. Non-communicable disease account for about 68% of all deaths, showing the shift from infectious disease to chronic lifestyle-related disease. For adults, the leading causes include ischemic heart disease, stroke, diabetes, and cancers. For children, the main causes are pneumonia, neonatal complications, diarrhea disease, malnutrition, and dengue fever. This shows that adults face chronic disease while children still struggle with preventable infections and nutrition problems. The Filipino face a clear doubt burden. Non-communicable diseases such as heart disease, stroke, diabetes, and cancer are now top killers, driven by smoking, poor diet, physical inactivity, and limited routine health care. At the same time, infectious disease remain a major concern. Tuberculosis, dengue, pneumonia, and the diarrhea disease still affect a large part of the population, especially in low-income rural areas. Overall, the country is dealing with both modern and traditional health challenges, which put lots of pressure and challenge on health system. Now I would like to pass to Daniela.
Hello, my name is Daniela. I'm talking about the public health issues. We have substandard healthcare facilities. Many healthcare facilities, especially in rural and remote areas, lack essential resources and infrastructures, which make the quality of medical health in the Filipinos very low. Next. The pie chart shows how the healthcare spending in the Filipinos is divided. About 63% come from out-of-pocket payment from the Filipinos, which creates a heavy financial burden on the people. Only 27% come from the government, showing limited public funding and unequal access to healthcare facilities in rural areas. Private insurers make up only a small share, reflecting low insurance coverage overall. The main takeaway is that the Philippines depends highly on personal spending, which affects rural people. Next. We have high prevalence of HIV cases. HIV continues to be a major public health issue concern in the Philippines and is mostly among young adults when men have sex with men and people inject themselves with drugs. A high rate of HIV infection has been a high prevalence in the Philippines for a while, leading to antiretroviral therapy and other diseases. Next. The graph shows the rising trend of HIV infection in the Philippines over the past decades. Unlike some other South Asian countries, where HIV has been going down, cases have increased in the Philippines. Most of these infection cases are among people from the ages of 15 to 35, especially in cities like Cuba. This rise reflects gap in sexual education, limited access to testing, and low awareness. The key point takeaway here is that HIV in the Philippines is not just only a medical issue, but is also a social and educational challenge, which prevention remains limited. Next. Typhoon and flooding. There have been frequent cases of typhoon and flooding in the Philippines, which has caused a wild spread of public health effects. Flooded waters contaminate drinking waters, which leads to waterborne outbreak diseases such as cholera, typhoid, and hepatitis, and also the destruction of properties, roads, bridges, which limit people to have access to healthcare facilities. Next. These public health issues were chosen because they are the emerging and rising issues currently faced in the Philippines, and with continuous resilience, they continue to become more or less in the country. I'll be passing it on to my next colleague.
Hi, my name is Kelvin, and I'll talk about the risk factors and the most affected populations on each public health issue. So for the first one, I'll list a few of the risk factors. So for the risk factors are shortage of trained doctors and nurses, which also leads to inadequate medical supplies and outdated equipment. Poor infrastructure leads to unreliable water, electricity, and sanitation. Overcrowded hospitals and clinics, long travel distance to also access care. The most affected populations are rural and remote communities, pregnant women and newborns, children under 5, elderly individuals, and people with chronic diseases. For the second public health issue, that's high rate of HIV and cases. Next slide, sir. The risk factors come in place with limited access to HIV testing and ongoing ART treatment, high risk sexual behavior, stigma and discrimination, low sexual health education, and needle sharing among people who inject drugs. The most affected populations are usually young adults, sex workers, men who have sex with men, and people who inject drugs, and low income and undeserved communities. For the third slide, as typhoons and flooding. The risk factors that come in place are contaminated drinking water after floods, poor drainage and sanitation systems, overcrowded evacuation centers. Also have mosquito breeding in stagnant water, and also that can lead to damage to health facilities and roads due to the typhoons and flooding. The most affected populations are usually low-income families in flood-prone areas and children, pregnant women, and elderly individuals, and people with disabilities. Pass it on to the next person.
I'm Alfredo. I'll be presenting our recommendation action plans for improving public health in the Philippines. So first, to address substandard healthcare facilities, we recommend upgrading hospitals and clinics in rural areas by improving electricity, clean water access, and essential equipment. While these upgrades happen, mobile health clinics can be deployed to ensure people can receive care. We also suggest accelerating the training of nurses and midwives to reduce staff shortages. These actions require coordination between the Ministry of Health, local governments, and organizations like the WHO. Mobile clinics should be operating within the first 6 months, while full facility upgrades may take 1 to 3 years. The expected result is more reliable healthcare and lower maternal and child mortality. Second, next, to reduce the high HIV prevalence, we recommend expanding free confidential HIV testing and increasing access to retroviral therapy. Public stigma remains a major barrier, so youth-focused education and awareness campaigns are important. Partnering with the NGOs such as Love Yourself Philippines can help reach vulnerable populations. Testing expansion can begin within 3 months, and a full national awareness campaign could roll out within a year. These efforts will help reduce new infections and ensure earlier diagnosis and treatment. Finally, to the third next, to address typhoon and flood-related health risks, we recommend prepositioning clean water tablets, essential medicines, and shelter supplies in high-risk regions. Strengthening early warning systems and integrating disaster preparedness into primary healthcare can also be critical. Short-term actions such as stockpiling supplies and improving evacuation plans can be implemented within 3 months. Longer-term upgrades like building climate-resilient health facilities may take several years. These steps will reduce outbreaks of waterborne diseases and improve community resilience. Next. So to end with, the Philippines is a nation with incredible resilience, yet it continues to struggle with serious public health challenges such as those discussed and many more. These issues are not just statistics. They impact real people, families, and communities. By focusing on better healthcare systems, stronger prevention programs, and disaster preparedness, we can help create healthier future for Filipinos. Thank you.
Thank you. This is our reference page.